Mhm. Yes, this is our the picture of our city, Baku city. It's located on the shore of Caspian Sea. It's a land of fire, the city of winds, and it's located geographically in Europe and Eastern Europe. It's linking Europe to Asia, and all Chinese Silk Way also pass through from Azerbaijan, our country. We have neighbors with Georgia, Russia, Armenia, Iran, and Turkey, and with Turkey.
Very nice.
Our country is an oil-rich country. It's an upper middle income country with high GDP rate. Yes, we have highest GDP rate in the region, in South Caucasus region. But I just would like to stress here that the gross domestic product is not a country reliable measurement for health and social needs. And the COVID-19 is a global health security problem. Azerbaijan is leading for daily new confirmed COVID-19 new cases per million people among Commonwealth of independent states. It's post-Soviet Union countries, as we are in the first place for this rate. And we have challenges regarding COVID and TB. COVID increased and left the TB behind, other diseases behind. Also, TB human resources staff, medical doctors, scientists, and also medical facilities involved in COVID-19 response. It's created extra challenges for TB response. And also from September till mid of November, we had military situation in the country. Therefore, TB services distracted in 10 borderline regions due to lockdown plus military situation in the country. Also, we have challenges in collection of sputum regarding lockdown, as public transport restricted and people can leave their houses only 2 hours in a day. They cannot come to health facilities. The number of visits to health facilities significantly decreased during the lockdown, and limited capacity of mobile TB detection tools. As you know, during the pandemic, it was an issue to increase the number of mobile tools, mobile health tools, or diagnostic tools, also virtual platforms to ensure universal health coverage. And we have actually 2 mobile TB X-ray tool in prison, available in prison for mass screening, and 1 in national TB program. It's Korean Hyundai model, and in prison we have Toshiba model that was purchased 2008. And we have insufficient legal base of testing TB patients for COVID in the government. But NGOs can do this to test TB patients for COVID. Yes, testing is inaccessible because the test centers do not provide services to those who do not show any sign and symptom of COVID. And therefore, TB patients can give tests only by paid. And as TB population are socially vulnerable group in the country, it's also a challenge for TB patients to get tested by paid. And also we have 1 million IDPs and refugees in the country. Only 70% of IDPs and refugees have access to primary health care during the pandemic and the regular times. We have a 24% decrease during 9 months of 2020, comparing with 2019 last year. And this figure, we forecasting this figure will rise in recent COVID-19 burden days. And what government did in the fight against COVID-19, we launched a foundation to fight against COVID-19. We started PPE production in the country as this was a great challenge in the beginning of the pandemic outbreak. And we invited doctors from Russia, Turkey, China, Italy, and Cuba to train our health personnel also to help our battle against COVID. Also, USA, Japan, EU, China, Jack Ma and Alibaba foundations donated to Azerbaijan some equipment, PPEs, and etc. And the government built 11 modular hospitals. Each of them has 200 beds, and we did 2 million COVID tests. NGO contribution in our country, we have a strong coalition, NGO coalition that's called Tuberculosis Azerbaijan Coalition. Included 7 organizations who are each very active in TB response, also COVID response during the pandemic. Just give some overview about huge contribution of CSO in Azerbaijan. This project started initiated by International Committee of Red Cross to follow ex-prisoners TB treatment in civilian sector, and then they hand over this project to Azerbaijan Saglamlığa Khidmat Public Union, our NGO. As the prisoners enrolled TB treatment in prison, they released from prison without completing their TB treatment, and our NGO was involved to follow their treatment in civilian TB facilities. We started education counseling sessions in prison, and after release, we contacted with ex-prisoner, associate them to register in civilian TB facilities. Also, we provide information exchange between prison and civilian health facilities. After registration of the patients, we visit in a monthly basis to them. We deliver their anti-TB drugs to prison, getting they from prison. We deliver them to TB cabinets in their living places, closer their living places. Also, we collect sputum specimens every month to deliver to penitentiary lab. After the intervention of our CSO, treatment continuation rates of ex-prisoners increased from 10% to 97%. And we have, as a TB coalition, we have experience with mobile X-ray machine. We conducted in 2011 active case finding among key populations. We did questionnaire screening and chest X-ray. Also, we are, as civil society organization, we are very active in developing and improving TB policy in Azerbaijan. We have good collaboration with members of parliament, and we developed intersectional partnership between government and MPs. We have friendly relationship between governmental organizations, NTP, and we developed a great strategic plan, national TB strategic plan, with jointly with civil society and community members. We did a public hearing at Azerbaijan parliament twice, and all these interventions strengthened in the recent years civil society and member of parliament relationship. We have best practices of Azerbaijan. Our best practices published several times in WHO related journals and other scientific journals. Also, our NGO's abstracts were presented at a union conference on lung diseases several times. This is an algorithm of active case finding in prison. Step by step, they begin from health education, they conduct questionnaire screening, then phlebography, then sputum collection and lab diagnostics, and the detected cases then enrolled to treatment in centralized prison TB hospital. And health education again will continue. My colleague, Dr. Fahmi Mamadov, is from main medical Department of Ministry of Justice, and if he have any additional information, he can add. Global funds financed activities for the next years. As I mentioned before, that we have IDP problem in the country. Only 70% of IDPs have access to TB diagnostic TB services. It's planned within the Global Fund project to arrange TB mobile team to provide TB testing and screening, transportation of biological materials, sputums, distribution of drugs for TB patients who are living in remote areas. And there is a great need to procure portable X-ray, Niban, and GenExpert instruments for the next years. Deadly Divide report. This report was prepared by also TB community over the world. As you remember, in 2018, UN member states signed a declaration in order to end TB till 2030. And we are struggling here now with COVID-19 pandemic. We are very far from our targets mentioned in that declaration. Even we are rolling back in our targets. We as communities call upon the governments in order to take actions to reach all people through TB prevention, diagnosis, treatment and care, accelerate the development and access to essential new TB tools, and also we call the governments to scale up access to newer, safer, quicker options and fast-tracking the development of priority innovative new tools, rapid user-friendly and point-of-care testing. And this is the heart of my slides, how artificial intelligence and portative X-ray can improve situation related COVID and TB in our country. We think that this intervention can improve, can ensure universal health coverage through advancing TB COVID-19 control at the country level, strengthening case finding and contact tracing in high burden areas, key population, ex-prisoners, prisoners, contacts of them, family members, people living with HIV and risk groups can get accessible and quality of TB diagnostics. Also, NGO coalition can pilot the X-ray machine to support, to assist national TB program in the aim to convince technical specialists that that is one of the advance. Also, this tool can ensure financial sustainability of civil society organizations in engaging TB response. The results of the pilot project will be presented to Global Fund, Ministry of Health, Mandatory Health Insurance Agency to scale up using of artificial intelligence in the whole country. The pilot activity also can be complement prerequisite to national TB activity plans and guidelines. It's a real value, we think it's a real value for the money to invest to health services in the country. Thank you for your attention, and we think that if we organize our work in balance, we can manage incredible workload. Thank you.